Hi, everyone. Good afternoon. It's good to see you all. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. And I guess it's Happy New Year because we haven't actually had a Thrive Kentucky webinar since the new year began. And our last state and federal update was before or during the federal shutdown in the fall. So we have a lot to catch up on and a lot to share related to everything that's happening now with the state legislature being in session and other things happening at the federal level. So we're going to get right down to it. Why don't we go to the next slide? All right. For those of you who may be joining us for the first time, I know we have a lot of regulars on here, but Thrive Kentucky is a coalition of organizations working to make sure that all Kentuckians have their basic needs met through policy change and systems change. And so we really focus on policies that create a welcome mat or help to kind of level the playing field for Kentuckians to make sure that everyone can have those needs met. And we will be sharing these slides out along with the recording when you have a chance, if you want to learn more about some of our policies and the principles that guide our work, you can look at more closely at this slide. On the next slide, you'll see the different members of Thrive Kentucky, our websites. So if you want to learn more about any of our organizations, you can go here and use those hyperlinks to get more details about the work that we do. Why don't we go to the next slide? So Thrive has been around now for, I would say, 4 or 5 years. Every year, we ask for sponsors to support this work because the advocacy series that we put on, each of our organizations contributes our time, and in many cases, when we hit the road during the spring, summer, fall, and we're coming to communities, we are incurring some costs in terms of staff time and travel and all of the materials that we're using for our road show. And that's something that our sponsors help us with to make sure that we can continue to do this series free of charge for our participants, and even offer CEUs for social workers and for certified community health workers who are our boots on the ground every day in communities helping people access these services and programs. And so if you're interested in sponsoring Thrive this year, please let us know. Kelly Talby is the best person to contact for more details. And we'll continue to, accept new sponsors kind of on a rolling monthly basis. We can go to the next slide. So Thrive, our series of webinars, our road shows, we're starting to get, that whole program kind of scheduled now. So you can see here the schedule for the year so far. And some of this may change, or we may add something as time goes if there's a need to. But these are the webinars and the in-person, or actually, these are just the webinars, I should say, that we have scheduled now, along with the forums with our Cabinet for Health and Family Services. So make sure to get those on your calendar. If you haven't already registered, I think you can register for all of them at one time. We may have changed how we do registration this year just for security measures, but make sure that you have these dates on your calendar. We can go to the next slide. So just a little housekeeping before we begin. We have a lot of folks joining us today. Always try to keep your line muted. Use the chat for any questions or comments, and we try to get to those as we go along. If there's anything that we can't get to in the next 90 minutes, we'll make sure to put any follow-up in an email along with the slides, the recording, and any other resources or materials that we share today. And then there were a couple of questions that came in during registration. One was about the impact of behavioral health grants that were set to end. And at the last minute, that decision was reversed thanks to the advocacy of many, many behavioral health providers and others who know just how essential those services are to communities. And I think that Dr. Schuster will probably talk a little bit more about that. And then another question was, is there one or two concrete things that we can do to advocate for these issues? And just acknowledging that many of us are just simply overwhelmed by everything that's happening both locally and nationally. So thinking about some concrete steps would be helpful. I hope that we can offer some of those concrete steps today, particularly around, legislation or other opportunities that are happening now in which you can advocate. Again, if you have questions, put them in the chat as we go. CEUs, I mentioned, are available for social workers and for certified community health workers. And if that's you and you'd like to get credit for today, be sure to complete the evaluation that we're going to send out in our follow-up email. And we want everyone to give us their feedback. So please don't let it stop you if you don't need CEUs. From giving us that feedback in the evaluation. But if you do need CEUs, then you absolutely have to do that in order to get them. So with that, I think we've kind of covered everything that we need for housekeeping. Oh, just a reminder, for security purposes, we have started using focus only mode. And so you won't be able to see each other, unfortunately, but you will still be able to use a chat. You can see us as we're speaking, and hopefully that'll keep any Zoom bombers away. So we can go to the next slide. This is the agenda that we're going to be covering today. And I'm going to turn it over to Dr. Schuster to get us started with a legislative update.
Thank you very much, Emily. I'm Dr. Sheila Schuster. I'm a psychologist with the Advocacy Action Network, and I'm glad to talk to you about the legislative session that we are in. I think today is the 18th day of the session of a 60-day session. Next slide, please, Brittany. So just a couple things to remind you, this is a tough time because everything seems so polarized and partisan. Just want to remind you that our issues really are not partisan or political. There's nothing partisan or political about people having a roof over their head and food on the table and access to healthcare, dental care, mental health care. But the process certainly is political, and we need to make that distinction. The party that holds the majority of the power, but everyone is an influencer. And the leadership has great influence, as do committee chairs. And just a reminder to those of you in rural areas that so many of the leadership of the House and Senate of the Republican Party are actually from rural parts of the state. And then a final reminder that those who love sausage and the law should probably not watch either being made. But if that keeps you away from the legislature, then you can ignore that. So we started on January 6th, and we will adjourn according to the Constitution by midnight on April 15th. We have linked you to the standing committee schedule so that you can tell, for instance, when the Senate Health Services Committee meets regularly and when the House Education Committee meets. The busiest days are Tuesdays, Wednesdays, and Thursdays, with committee meetings from 8 a.m. to about 1:30, and then chamber sessions at 2 o'clock. Mondays and Fridays are shorter because they're travel days, and they usually go into chamber on Mondays at 4 p.m., and then they go into chamber early on Friday mornings, usually around 9, and then they head home. Next, please. So this is the state legislative calendar, and as I noted, we're here in February. We'll have a holiday for President's Day coming up in mid-February, and again, we're on about, I think, day 18 of the schedule. The last day for new bills to be filed in the Senate is March 2nd, and in the House is March 4th. So some of us feel like we're drinking out of a water hose or a fire hydrant, because we're trying to keep up with all of the bills that are getting introduced, many, many, many during the day. The veto recess days, when there is no session, are April 2nd to the April 13th. Some of those dates may be changed because we missed a day because of the snow a week ago Monday, but these are give you some idea about the schedule coming up. Next, please, Brittany. So we have an accessibility guide that my organization and KVH, and I want to thank Kelly Talby of KVH for all of the background work that she did. There's lots of changes, both in the physical setup, but also in the rules of the House and the Senate. So if you've not been to Frankfurt, you will be surprised to see that the Capitol is absolutely closed. And it may be for 5 to 7 years. There's so much that's being planned there. So there's no indoor space available for the large rallies that we used to have in the rotunda, and only limited meeting rooms available in the annex. Um, they don't have the Capitol to do their chambers, House and Senate. So there's a new structure really built on the top floor of the parking area, but there's no access to it for the general public. So you're going to have to, if you're in Frankfurt and they go into session, you have to go to assigned rooms in the annex, and you can watch it on KET. Obviously, wherever you are in the rest of the state, you can tune in on KET. And there may be some limited access in the hallways. You still have to come in and show your ID. And I would warn you that you need to leave plenty of time to get in through that process, because it's taking a lot of time to process everybody in to get them into the annex. Next, please. So here are some good bills to watch. I'm not going to go through all of these. These are hyperlinked, which means that you can click on them. Holly just put that note in the chat. Thank you. And they range from increasing child nutrition in the schools using Kentucky grown products, to making it easier to renew your driver's license to get other documents. The regional system is not worked very well. There's a bill around paid maternity leave. Two bills. These are called companion bills, Senate Bill 38 and House Bill 3, meaning the same bill was filed in both the House and the Senate, so you can watch it either place. To make sure that pharmacists are getting the same reimbursement from Medicaid for the services that they're providing. There's a good bill on mental health. We've had a diversion program giving convicted persons the option to go for treatment rather than incarceration. And it's had a successful first 5 years, and this would extend it for another 5 years. There's a feasibility study around different ways of doing the Medicaid reimbursement model. Food is medicine has really gained some traction in trying to advance initiatives around that. There's a bill that would help all providers of behavioral health, dental health, and mental health from prior authorizations, which is a requirement that the MCOs and the insurers impose. A bill to make sure that mental health and substance use disorder coverage is on an equal basis with physical health coverage. Charitable food donations, which Jessica may mention, and some ways to increase the Affordable Housing Trust Fund, which probably Adrian will talk about. A 1 week waiting period is being eliminated in unemployment benefits. And then we have tried this bill before. This is Representative Moser's bill, House Bill 459, to try to get really good data from the professional licensing board, so we know what our workforce looks like. Next, please. I could have probably done a whole nother slide or slide and a half about bills that we're concerned about, but here are the top ones. Senate Bill 26 would eliminate all diversity, equity, and inclusion programs in grades kindergarten through 12th. There are a number of bills that would allow a homeowner to freeze or cut property taxes. And it sounds like a good deal for the homeowner, but it's really a bad deal for local governments, school boards, and emergency services, because those property taxes help fund all of those. There's a bill that's been around for 5 or 6 sessions that we have fortunately defeated, and it's back again, and allows actually healthcare providers, but also anyone who works at a healthcare facility can decline to provide any kind of service on the basis of their conscience. There are 2 bills, one in the House and one in the Senate, to make water fluoridation optional to local control, meaning it would no longer be statewide. There's a bill that's actually moving that would allow 18 to 20-year-olds to obtain a license for concealed gun carry. And there's a bill that wants to remove the requirement for hepatitis B immunization and prohibit the expansion of required immunizations for children, which we're concerned about. There's a big bill that was filed last week on Medicaid reforms that we're still trying to plow through and make sure we understand. But it has tries to codify a lot of what was in the federal law and put it into state policy. And then the budget bill was just released late last week, House Bill 500. It's not as big and as dense as it has been in the past because the process now is to try to add to it through the budget review subcommittee process. And we'll talk about that next. Next, please, Brittany. So the budget is, as you know, the kind of moral compass for the Commonwealth. The long and short of it is that we need to be sure that our people are at the top of the priority list when it comes to budgeting. The governor released his executive branch budget in its House Bill 304, but it really will not be considered. And as I mentioned, House Bill 500 is now out and about, and there will be changes in it. State revenue projections are down, so there may be less money to budget with, but there's $3.7 billion, that's with a B, in the rainy day fund, if the legislature would deign to use that money. They used some of it in the last biennial budget on one-time expenditures. Next, please. So I mentioned the budget review subcommittees. They are something that you all may not have paid a lot of attention to, but what Chairman Petrie, who's chair of the House A&R committee, has said that these budget review subcommittees are going to be the way to kind of fill in missing pieces of the budget. So we've listed here the House Appropriations and Revenue Committee meets on Tuesdays at noon. And then the one that many of us will be looking at most closely is the Budget Review Subcommittee on Health and Family Services, because that is going to be almost everything that's in the cabinet for health and family services. So if you have a need, for instance, I mentioned later in the behavioral health section that there's no funding in this budget for additional placements or slots in the Medicaid waiver programs, and that's something that we've got 16,000 people on those waiting lists. Many of you are concerned about education funding, and the BR on primary and secondary education meets Tuesdays at 10. And then the budget, public safety, and judiciary meets on Tuesdays. So we've posted that committee schedule for you, and those are live links that will take you to the website, and you can see there who's chairing those subcommittees and who the members of the subcommittee are. So that's where you really want to focus your advocacy if you're going to be looking for some funding to be put into the budget. Excuse me. Next, please. So just to mention that the Medicaid Oversight and Advisory Board, which was started in June of last year and met 9 times, we finalized, because I'm on that, the findings and recommendations in January. There will be a meeting of that MOAB every month, they said, during the session, but we do not have those dates. So we will get that information out to you. But if you're interested at all in Medicaid, you want to be watching this MOAB meetings. Next, please. So just a reminder that you have 2 main ways to be advocates. One is your voice, to speak up and to speak out, and the other is your vote. So 2026 is a big election year in Kentucky. We have Senator McConnell's seat since he is retiring, and all 6 congressional seats. We have 60 of 100 House seats have contested elections, and 11 of 19 Senate seats. So the May primary is May 19th, and then the general election is November 2nd. And just a reminder, if you know somebody who's turning 18 this year, you could go on and get them registered, and they can vote as soon as they turn 18. So just remember that the best way to advocate is to influence others to vote and to speak out as you yourself are voting and speaking out. And I will turn it over to, if Dustin is with us, the federal update. Thank you.
Yes, ma'am. Good afternoon, everyone. My name is Dustin Pugel. I'm the policy director at the Kentucky Center for Economic Policy. We're a nonpartisan nonprofit research and advocacy group and a happy part of Thrive. So wanted to share a little bit about some federal changes that have been in the works. And their changes should be like underlined and italicized and bolded because there have been a lot of changes back and forth over the last month and then late last year as well. So Emily already mentioned that the federal government announced a really massive freeze of SAMHSA grants to Kentucky. These are grants that support all kinds of mental health and behavioral health and substance use disorder treatment facilities. Kentucky had $74 million in discretionary grants that were frozen at one point. And then literally 2 days later, that freeze was rescinded by that agency. That's great news. However, for those organizations in those 2 days, it was anguish. It was really concerning. A lot of folks thought they were going to be losing their jobs. A lot of folks who were receiving treatment and care were worried that they were going to lose that. So, that kind of activity is really disruptive, even though ultimately that money is still flowing. We're hopeful that won't happen again, but of course we need to stay on top of things. Similarly, there was a pretty significant change to how continuum of care grants were being awarded by the Housing and Urban Development Cabinet. You all have heard about this from Adrian before, so I won't go on too long about it, but a judge in Rhode Island temporarily prevented that notice of funding opportunities from moving forward. And I will mention this here in just a little bit, but the current budgeting process at the federal level is putting some guardrails in to try and make sure that that kind of abrupt change that would result in a lot of folks potentially becoming homeless again doesn't take place. There's also a new rule related to childcare, specifically the ways that childcare providers are reimbursed through our childcare assistance program, how that's done. During the Biden administration, there were some changes that really made it a lot easier for childcare providers to plan, made sure that the funding levels were more stable. And unfortunately, this rule kind of reverses that. It also removes a cap on how much families are required to pay in copays, which is a significant problem, especially for for household of any income level, because childcare assistance really only primarily benefits lower and middle income families. You all may have also heard that several blue states or states that were run by Democratic administrations we're having several grants being paused, including childcare, but also TANF and others. That is another action that has been frozen by a federal district judge as of January 23rd. While that process goes through the courts, that will continue to remain frozen. So, I think at one point there was some concern that Kentucky may have been caught up in part of that grants freeze, but we were never affected by that. And at this point, other states have had their freezes reversed temporarily, at least. What is not temporary, though, is a significant reduction in the federal workforce here in Kentucky. There are, as of November of 2025, I think we have one more month of data since then, but comparing November of 2025 to November of 2024, there are 2,800 fewer federal employees in Kentucky. So if you look at this graph, this is the change in employment by industry, looking at that same 12-month span of time. And as you can see, federal employment was the biggest sort of loser, if you will, over that period of time. That's really significant, not only because of the way that impacts services in Kentucky, but also because those are, that's income that was being brought into the state from federal sources, which are primarily, from taxes paid in larger states like California, Texas, and New York. So, that is a real economic hit to the state. And hopefully, we don't know the answer to this, but hopefully a lot of those folks have already found employment elsewhere. So that's kind of what's been happening administratively at the federal level. If we go on to the next slide, we're also going through a budgeting process right now. There was a pretty significant change in direction in the budgeting process following the deaths of two protesters in Minneapolis. Democrats in the Senate have said that they won't support a full extension of the budget for the Department of Homeland Security, where ICE is housed administratively. And so they've agreed in the Senate to a full extension for these other agencies: Defense, Homeland, Labor, Health and Human Services, HUD, Transportation, and Education, but only a 2-week extension for the Department of Homeland Security, so that during that time there can be a negotiation around certain guardrails for the way ICE operates. We're not sure what those will look like yet, but at this point it's up to the House to agree to that. We think there will be a vote as early as 4 o'clock today, although it looks like it could also be sometime tomorrow, depending on how Speaker Johnson is able to wrangle his members. Unfortunately, there's not an extension of the enhanced premium tax credits as a part of that package. This is obviously concerning given all of what we know about how much rates have risen already for folks. So, we're going to move forward instead, potentially with a different healthcare bill that looks more at PBM reforms and extra funding for community health centers, but unfortunately, again, no extension of the APTCs. If we go to the next slide, if you have opinions about any of this, Dr. Schuster had already said that, you need to make your voice heard. So we will be sending these slides out later. Please feel free to reach out to your member of Congress and our 2 senators about, how you feel like this budgeting process needs to go. I think we've learned through a lot of these administrative freezes how important the federal budget is to Kentucky. We are a really significant recipient of federal funds. And so it's important for us to speak up. So with that, I'm going to hand it over to my colleague Jessica to talk a little bit about food.
Thank you. Hi, yes, I'm Jessica Klein. I'm a Senior Policy Associate with the Kentucky Center for Economic Policy, here to cover all of our food assistance programs, so SNAP, WIC, and senior meals. Next slide. And a little bit of background about hunger in Kentucky, which seems to be getting worse. Kentucky is the 7th hungriest state in the nation. 1 in 4 of our hungry people are children, and we also have the 2nd highest rate of hunger for people 50 to 59, so not doing so well in terms of how we rank. Next slide. And our best tool against hunger is the Supplemental Nutrition Assistance Program, SNAP. It provides about 13% of Kentuckians with food assistance. They receive an average of $174 per month. We reach about 597,000 Kentuckians. This graph is really showing how receptive SNAP is to policy changes. Policy changes quickly change who is able to participate in the program. So a lot of these changes indicate both changes in our economy and policy decisions that have happened over time. And one other note about SNAP is that we have some of the lowest reach of the program, so we're only reaching about 2 out of 3 eligible people in Kentucky. Next slide. And despite how effective SNAP is in terms of reducing food insecurity, it saw the largest cut in funding in history, a $300 billion cut over 10 years this summer. And that comes at a time when both grocery prices are increasing and hunger is as well. So this will look several different ways as it comes down the pike to Kentucky, but some of those changes have already happened, so I'm happy to go through some of those. So the first I want to touch on is the cost of SNAP will be shifting more towards states. So that includes both an administrative cost and a cost of the benefits, the actual food stamps that go to people. The second is the expansion of work reporting requirements. These are ineffective requirements that create barriers for people to participate in the program. And it's expanding to families with teens over 14, people 55 to 64, veterans, people experiencing homelessness, and former foster youth. And that expansion began in November. And I'll be talking a little bit more about that requirement. The 3 other changes that I want to mention are the changes to some of the deductions in the calculation that determines how much benefits people receive. So that's things like utilities and internet deductions, and also who is eligible for the program, so legally residing immigrants. Next slide. So a little bit more on these federal cuts. And just the reach of these cuts is really expansive. So in addition to all of the seniors and people with disabilities that participate in SNAP, we also have many children in Kentucky. Again, about 40% of our participation is kids. So that means that children will also be losing food both at home and at school. About 82% of students in Kentucky are qualify for free and reduced meals, and their qualification for that program is based on their SNAP or Medicaid participation. So as we see a decrease in participation in both SNAP and Medicaid, that means school meals participation will also be decreasing. So an increase in hunger in Kentucky. Currently, there is a threat to our free school meal programs, which is House Bill 277 in session, and that's would require schools to reduce ultra processed meals, which, of course, we would all like children to eat less processed food. But what that does is it doesn't adhere to all of the school meal programs. So it would disqualify some of the schools for those food assistance programs. Next slide. A little bit more on the work reporting requirements I mentioned began again in November and started to expand then as well. So missing 3 months of this work reporting across 3 years will result in losing SNAP. And we've learned that in the past when this has been implemented that people did lose their SNAP benefits. So this expansion began in November again to people with children over 13, veterans, people experiencing homelessness, and former foster youth, and also older adults. So this requirement is required of all of those Kentuckians in every county. We used to have a waiver that didn't allow people who lived in areas of economic downturn to have to do this reporting. And that was 117 counties that got that waiver. And unfortunately, as part of that House Bill 1, that waiver ended as well. So all counties in Kentucky now have to do this reporting. There is an opportunity here, though. House Concurrent Resolution 9 would recommend that the Congress continue one of these exemptions, which was for veterans. So that's one we want to point out. There's also a full list of the current exemptions from this program on CHFS's website, so you can learn more about those exemptions there. Next slide. So the other piece that I mentioned was the federal shift to states to pay for their SNAP program. So this is both an administrative cost and also a cost share of the benefits. The administrative cost would begin in 2026, so that means immediately we would need to see an additional $50 to $60 million per year in Kentucky. This has not been included in the House budget that Dustin mentioned and Sheila mentioned as well. So we definitely want to see that included and kind of an answer for how the House plans to pay for SNAP and this additional administrative cost in the next 2 years. There is also a cost for our state cost share based on an error rate. So an error rate is a measure of how many or too few benefits are being distributed. It's not a measure of fraud or administration. So we don't have a full answer on what our error rate is going to be. So we don't have a full answer on our administrative cost for the benefits just yet. Next slide. An additional threat that we expect to see this legislative session is around the SNAP restrictions that limit how people can spend their SNAP benefits. This is something that was discussed in the interim and last year as well. And over 18 states at this point have been approved for a SNAP restrictions waiver. So we are expecting a continued conversation around SNAP restrictions this legislative session. And ultimately, this restriction requires people to stick to a strict list of how they spend their food assistance and really puts retailers at risk by having them to enforce this rule that's really difficult to implement. And what we really know is that people with SNAP shop the same as people without SNAP, and that restricting how people buy their groceries doesn't actually have an impact on nutrition or health behaviors. So this isn't a proven public health approach to improve nutrition. And we like to point to other incentives that create opportunities to get more healthy foods. That's things like the Kentucky Double Dollars program, where you can get double your healthy food for your SNAP dollar at a farmer's market or a local retailer. Next slide. And our final ask is that we fully fund senior meals as well. So I mentioned that there are 1 in 5 seniors in Kentucky that are hungry. Again, we have one of the highest rates in the nation. And we do have a really great program that provides meals both in congregate setting in senior centers, but also at home for those that are homebound. So that's through our Department of Aging and Independent Living. We would love to see the funding for this to continue. And so far it has been included in the budget for the Department of Aging and Independent Living. Next slide. Here are some additional resources for you all. So great map here on all of our food banks and additional resources on how to access SNAP, WIC, and senior meals. Thanks. And with that, I think I turn it on to the next speaker. Yep, back to you, Sheila.
Thank you, Jessica. So here I am again talking about behavioral health. Behavioral health is mental illness and substance use disorder collectively. And then we're also going to talk about Medicaid waivers. Just a reminder, and you hear a lot about these social, health-related social needs, and you hear it here from Thrive, because we look at employment and unemployment, we look at housing, we look at food security, we look at access and quality of health care, we look at what's happening in neighborhoods and in communities, and we look at certainly income. And we know that all of those affect not only physical health, but certainly mental health and increase the risk of mental illness. Next, please. So Medicaid is absolutely the largest payer of behavioral health services, that's mental health and addictions, in Kentucky and also across the country. So the impact of the One Big Beautiful Bill Act, HR 1, will really have a negative impact. Will also have a negative impact in people losing their health plan on Connect when they don't get the additional funding help that they've gotten in the past. So anything that interferes with access in coverage interferes with access to those services. We talk about the Medicaid expansion population, which joined Medicaid in 2014 as a result of Obamacare passing. And I just want to remind you all, because the legislators tend to really badmouth the expansion population. But if you look at what happened in the first 2.5 years of that expansion, the utilization of treatment services for addiction, for substance use disorders, went up 740%. So we had a lot of people that were needing treatment for their addictive disorders that were not able to get it until they got Medicaid. House Bill 695 at the end of the 2025 session also kind of honed in on behavioral health services. They are requiring a report on each service that has increased by 10% or more in the previous year. They also authorized that prior authorizations, which is a burden to providers and makes it easier for the MCOs to not approve services, had to be reinstituted. And both of those things, I think, are creating some real problems for providers and for the availability of services. We also have a large number of audits by the MCOs, which take up a lot of time and energy for the providers to make copies of hundreds of case files, to answer questions and so forth, and to suffer possibly what they call recoupments or clawbacks, where the MCO comes in sometimes 2 years later and says, well, that money we paid you for treating Jane Doe, we find now that she was probably not a member, a Medicaid member back then. So we're going to claw back or pull back from you that money that we paid. So all of these just make it much more difficult to get the services out there for people. Next, please. So the good news is that new behavioral health waivers are actually moving ahead. We have an SMI waiver that's now called RISE. and it was approved back in March of 2025. We actually had been working on it for 5 years before that, and it has finally been rolled out in 2 regions of the state. One is the Pennyroyal region, which is basically Hopkinsville and the surrounding counties in Region 2, and then also in Kentucky River and far eastern Kentucky. And the reason that those 2 regions have been opened up for the waiver is because we have providers that can provide all of the services. So they are continuing at DMS to enroll providers, and also we have already a number of individuals and their families who have indicated that they want to get enrolled in this. The biggest thing that it offers for people with severe mental illness is what we call supported housing, which is not just a roof over their heads, but all of the wraparound services that make that housing work. So people get help with their medication management and with getting them to therapy appointments and those kinds of things. Another population that had not previously been served with a Medicaid waiver are those Kentuckians with a behavioral health disorder who were incarcerated, because typically Medicaid is suspended when a member is in jail or prison. But this is an innovative waiver that's been rolled out in, I think, 4 other states already. And we are within months of it being rolled out here in Kentucky. It will serve people that are in prisons and also youth who are in the Department for Juvenile Justice facilities. And it will start offering services for their mental illness or substance use disorder 60 days before release, hook them up with their MCO, and then make a smooth transition, what we call a warm handoff, into the community. We know that what's happened in the past is that people have gotten discharged from prison or jail, and then they kind of fall into the gap. We don't hear from them, we lose track of them, and they either recommit or commit crimes again, or they go back to addictive behaviors or don't get the treatment for mental illness. So we're looking forward so much to April of 2026 to get this rolled out for this population. Next, please. So other waiver updates, the other new waiver that was rolled out in January is called the Child Waiver. It's Community Health for Improved Lives and Development. And it also is a 1915C waiver. It's really dedicated to youth up to the age of 21 who are high risk because they have significant service needs. And it provides a range of services that hopefully will help the youth and their families or their foster families or their caregivers for the youth to stay in their community and to be successful. Again, we are looking for additional providers, but that waiver is out and is enrolling members. They are asking for comments on the regulations, and you have a link there to take you to those regulations and tell you the process for submitting your comments. And then we have several other 1115 waivers, they're called. One is to get people with SMI 30 days of medically necessary inpatient treatment in a state hospital or in a freestanding psychiatric hospital. We also have a program that will give them medical respite or aftercare if they've been discharged from a hospital for either behavioral health or physical health. Many times people are discharged to the street and don't get the follow-up care that they need. So both of these are providing more access to services. Those needing SUD or addiction services can be in a 30-day facility of up to 96 beds, which had not previously been allowed. So these waivers are really opening the door to many more possibilities for treatment and aftercare for our people with behavioral health disorders. Next, please, Brittany. So I mentioned House Bill 2, and I think Priscilla will probably talk more about it. It was filed by Representative Fleming about 10 days ago. There are some problems with it, some things that we don't like, some of which are functions of the federal legislation, but copays are going to come back in 2028. And we had been finally successful in getting rid of copays. And these copays are going to be significant. They could be $20 for each health service. we are afraid that what's going to happen is that people are not going to get the services that they need until they're close to death's door or they need emergency services. Redetermination, at least for the expansion population, will now be every 6 months instead of once a year. And we know that any additional paperwork that's required of our Medicaid members results often in people losing their coverage. Self-attestation, Medicaid members will not be able to attest to their medical status in order to get exempted from certain reporting requirements, but will have to get probably a doctor's verification. And then the hardship exemptions are more narrowly defined, so not exempting very many people. The good things are that there are some managed care reforms that we really are happy to see, particularly around what we call network adequacy, which means do they have a provider in that area of care in a urban area, 30 miles or 30 minutes, in a rural area, 60 miles or 60 minutes. And unfortunately, some of the insurers have what we call phantom networks. They have a lot of people listed as providers who never have been providers or are dead now or not practicing and that kind of thing. There's some guardrails around audits, which we are really looking forward to. Much more data collection and transparency of a public dashboard for Medicaid data. That was a MOAB recommendation. And then a services organization that would increase accessibility to dental services and hopefully improve reimbursement. Next, please. So our 1915C waivers, and we talk about these in every webinar that we do, those are the home and community-based Michelle P, SCL, the 2 ABI waivers, the HCB waiver, and then the Model 2 waiver. And in 2024, there was an incredibly productive advocacy effort, and we got 1,925 new slots or placements funded. And the waiting list, unfortunately, has grown to over 16,000. And no new slots are in that House budget, that HB 500. So again, I want to urge people that are concerned because they've got people on the waiting list or they know people on the waiting list to go to your budget review subcommittee. In this case, it would be the one for Health and Family Services and really advocate for funding. The other thing that is changed by CMS and gives more voice to people who are Medicaid members or their caregivers is the creation of a beneficiary advisory council. They have now had their second meeting. Their chair is Emily Beauregard, who you heard from earlier, who heads up Kentucky Voices for Health. And then the MAC has been restructured, and I chair that MAC, the Medicaid Advisory Committee, and it will meet on February 5th. I think attending that 2-hour meeting, which you could do remotely, will give you as much update on what's going on currently in Medicaid as anything else. So if you really want to know about Medicaid, that's an easy way for you to do that. Next, please. So Dustin mentioned the SAMHSA. SAMHSA is the Substance Abuse Mental Health Services Administration, and they give out tons of funding all over the behavioral health community. At 8 o'clock one night, most of the agencies in Kentucky and across the country who were getting SAMHSA funds got calls from their state's behavioral health agency saying that they had received information that afternoon that all of those cuts were being ended as of 11:59 that night. So agencies were getting this horrible news with no opportunity to prepare for it. In some cases, because this was so widespread, this was $2 billion, billion with a B, affecting probably 2,800 grants. And I know in Kentucky, there was at least one agency, a nonprofit, that was going to have to close its doors because so much of its funding came from these SAMHSA grants. Another agency I'm familiar with because I'm on the board, it was a hefty amount of money that may have been as close between 5 and 10% of the budget of that agency. And with that kind of doom and gloom, the good news is that less than 24 hours later, we got word from ostensibly from the White House, but from DC, that the cuts have been completely rescinded and the grant monies were again flowing. And, there was great jubilation. And I've been doing this work for 45 years, so I was thrilled that there were enough people that cared enough, that got to people that would weigh in with the president and with the Sampson administration to change this. The bad news is that it's just a sign of how unpredictable this administration is. It's quite capable of wreaking havoc, and we certainly have seen that in so many areas. And that's scary. And it puts all of the nonprofits who are dependent on grants like this just on edge, which is not a good situation for the human condition. So we are grateful for the advocacy. We hope we never have to do that again for that kind of thing, but just a scary situation. One of the things that they said was that the priorities, even suicide prevention, no longer effectuated the program goals or agency priorities. And I'm not sure how a mental health agency cannot have suicide prevention as one of its priorities. So it makes absolutely no sense to me. And we're grateful that they're restored, but problematic. Next, please. So just want to remind you that the mental and physical health of LGBT Kentuckians is not good, always at risk. They're still recouping or getting used to all the changes that happened in 2023. There were changes again in 2025. And then there's going to be another big change coming if Senate Bill 26 passes. So anything that undermines the ability of the school setting to be supportive, not only of LGBTQ kids, but any kids who have something about them that sets them apart, whether it's a learning disability, the color of their skin, their language, whatever it is. Those are the kids that really suffer in the school setting. And when you have no programs to incorporate and make those kids included, it really hurts their ability to thrive, to learn, to make friends, and to do all the things they need to do in school. Next, please. So to remind you that the 988 Lifeline is out there. Unfortunately, the Trump administration ceased the funding for option 3, which was a special option that took you right to specially trained responders for LGBTQ issues. However, you could still call 988 and get some excellent help. And if your issue is specific about LGBTQ issues, you could call the Trevor Project. They are set up to handle suicide issues around gay rights and so forth. Next, please. And I just want to remind you that this is the best thing since sliced bread when it comes to finding help now for mental health treatment, substance use disorder treatment, recovery housing, naloxone, or just learning materials and information. It's run by all of these agencies that are down there, and the information is kept up to date almost on a daily basis. If a provider does not keep their information up to date, then they cannot participate. So you can sort by location, you can sort by the kind of care that you're looking for, you can sort by the kind of money you have available or insurance coverage. There are just all kinds of ways. So keep that handy, because I think that we need to make those resources available when people need them. Next, please. I think we have one more slide. So just a reminder that these are difficult times, and pay attention to yourself. Remember the airline adage, if the oxygen mask drop, put yours on first and then take care of the people around you. So many of you work in the communities and, are just worn down with what's going on in our communities, and now particularly with ICE and the attack on immigrants and so forth. So keep a good eye on yourself. Look for these signs. MHA, Mental Health America, offers confidential online screenings. And a lot of people are doing these kind of periodically, every couple of months, just to kind of keep an eye on themselves. And when in doubt, reach out for help. It's always better to catch a problem early on. No shame in doing that at all. Next, please. And we're ready for Priscilla. Thank you, Priscilla.
Thanks, Sheila. Hi, everyone. I'm Priscilla Easterling. I'm the Director of Outreach and Enrollment with Kentucky Voices for Health, and I'm going to go over some Medicaid and Marketplace updates. Next slide, please. So as Dustin mentioned earlier, there still has not been any action. Since the last time we talked, we were facing the enhanced premium tax credits expiring at the end of December. In the middle of December, the House Republicans broke rank and forced a vote on the ACA subsidy extension. That vote took place in January and it did pass. So that's great news. However, those subsidies did expire at the end of December, and currently the Senate has not taken any action to extend them or pass anything. So we are still sort of left waiting, and Kentuckians around the state are dealing with those increased premiums that we were worried about for months ahead of time, and now they've gone into effect and folks are paying a lot higher. The average monthly premium for Kentuckians more than doubled between 2025 and this plan year 2026, and the average jumped from $139 to $327. But there are more than 10,000 Kentuckians who are paying over $500 more a month, and some who are paying over $1,000 more a month for the exact same plan. So Kentuckians are suffering, unfortunately, and we really need Senate to take action. The good news is if the Senate does decide to take action and they do extend the subsidies at some point this year, it's not too late for Connect to go in and make those changes in the system and allow for folks to shop with a higher premium tax credits if those ended up getting enhanced and extended. But again, right now we're still waiting to hear anything from the Senate. So if you have a story, make sure to reach out to your legislator and let them know the impact that these increased premiums are having on you and your family and your community. Next slide, please. So speaking of open enrollment, with that in mind, this open enrollment, I think as we've had conversations with connectors and CHWs all across the state, it was a lot sadder. We're a lot more troublesome than previous years. Just from the data, we did not lose as many people as we initially thought. So for plan year 2026, we had 89,000 folks go through the open enrollment process and choose a plan. That's compared to over 97,000 for plan year 2025. So really only down about 8,000, 9,000, 10,000 or so. 8,000 members changed plans. 8,000 plus members changed their plans. They intentionally went in and made some sort of difference. They changed insurers specifically. Changed insurers specifically. We also know that CareSource left the marketplace for this year, 2026, and 7,500 of those 11,000 CareSource members did re-enroll in a plan through the marketplace this year. Overall, 16,000 Kentuckians downgraded from a silver or gold plan to a bronze plan. Again, I think that speaks to the affordability or inaffordability of those silver and gold plans and folks just choosing something that would still give them some sort of coverage and protection. Although bronze plans do typically have a higher deductible and they're lower a monthly premium. So more folks downgraded from the silver gold to that bronze plan. Overall, 10,700 people who were enrolled in a plan for 2025 just fully canceled a plan for 2026. So they left the marketplace entirely. But the good news is that still 14,000 Kentuckians enrolled in a qualified health plan for the first time. So even with all of the uncertainty, even with those increased premiums, we still know that more folks were able to get enrolled in a plan and get some sort of coverage for themselves or their families. Still, I think the overall message is that things look okay right now. We're glad that so many folks were able to get enrolled in a plan for 2026, but we're still keeping an eye out for the rest of this year. Health insurance tends to be one of the first things that people drop when an unexpected expense comes up. So not sure, here comes May and somebody has a car issue or something that they have to pay for. When folks are making that evaluation of where they can cut back in their budget, health insurance tends to be it. So we'll still be watching for disenrollments throughout the rest of this year. And that's why it's so important to make sure that you're reaching out to your legislators and letting them know what the impact of these enhanced subsidies going away means, what that looks like. If you know folks who are sort of struggling with being uninsured or need access to resources, definitely reach out to a connector and they'll be able to help at least connect them to some community resources. So with that, next slide, please. So just doing OBA check-in, the One Big Beautiful Bill Act passed back in July 4th, 2025. That was so many months ago now. And the first couple of changes happened at the end of December and now at the beginning of January. So beginning January 2026, it eliminated subsidies for all lawfully present immigrants with incomes under 100% of the federal poverty line. And there's some other changes within the marketplace side of things that happen in December, but most of those changes within Medicaid are coming up soon this October, which we'll talk about more as we go through this year. Next slide. Okay, so let's dive into HB2, which Sheila did cover a little bit of, and I'll go a little bit deeper into. So HB2 made some significant changes to Kentucky's Medicaid program, which currently covers a little over 1.3 million Kentuckians. And a lot of those changes are meant to really prepare Kentucky for the changes related to the One Big Beautiful Bill Act that I just mentioned. But there are also some new priorities that were included as part of the Medicaid Oversight and Advisory Board that was established last year. There are a lot of reforms, and some of them are problematic, some of them are pretty good. So let's start with some of the problematic changes. And Sheila already, again, covered a lot of these. So for the copays, this is also part of One Big Beautiful Bill. It requires new copays for Medicaid expansion adults over 100% of the federal poverty line, and it establishes those copays at $20, which is wildly high for a lot of folks. We know that any sort of copay often is a deterrent for folks to be able to go to the doctor or go seek care or treatment wherever they need it. And it establishes a $20 copay for most services. And it still adds some higher copays over time. We just generally think that HB2 should require the HB2 should establish the copays. Sorry about that. HB2 should establish the copays at the federal minimum of $1, which is still, I think that's too much because $1 is still a lot for some folks. But $20 is just way too high, and the federal minimum allows for $1. So HB2 should do that. Redetermination, it also makes some changes to the redetermination process. And it creates the One Big Beautiful Bill created some mandatory redeterminations every 6 months for folks in the MAGI category. folks over 100% of the federal poverty line. That's the Medicaid expansion group. And this would, it would require those mandatory, it sort of codifies that within Kentucky, and then it requires multiple database reviews. A lot of the information that is included in the redetermination process, there are multiple databases across state and federal systems that they're able to check during that redetermination process, and it directs that conflicting data where any source reflects ineligibility would trigger an initial finding of ineligibility. So instead of in the current system where folks, when they do those checks in the system, and when they make those checks during the redetermination process, and there is some sort of conflicting information, currently the Department of Medicaid Services sends out a notice saying, hey, this information might be conflicting. Can you give us some updates? Can you give us some updated information so we can verify your eligibility? This would change that process to instead immediately finding folks ineligible, and then folks would have to appeal that process. So very bad, problematic. For self-attestation, it also limits self-attestation and prohibits it entirely for income, residency, or age, which would make proving eligibility for exemptions for like homelessness or zero income. That would make it a lot more difficult, if not impossible, for folks to prove zero income if you can't attest to it. So there should be some carve outs. Sorry, so distracted by the chat. But there should be some carve outs that would allow, HB2 should allow self-attestation only when there's no conflicting state or federal data. And when necessary, there could be an option to provide third-party or non-relative attestation if there's no official documentation available. There also, it restricts the cabinet from seeking federal options to delay or waive implementation for hardship exemptions unless the General Assembly specifically authorizes it, which limits short-term hardship flexibility tied to unemployment, which is only allowed if county unemployment is at or above 10%. So also very troublesome there as well. Next slide, please. Let's move on to the good things. All right, so as Sheila also mentioned, there are some great managed care reforms. So it adds new MCO contract requirements, some marketing restrictions, network adequacy, not counting inactive providers, also establishes some performance withholds around preventative care, well care, prenatal, postpartum, emergency department utilization metrics, and it also strengthens provider support expectations, which we're also very excited about. We hear some trouble from providers in communicating with MCOs, so that's also a great change. It also provides some guardrails around audits and oversight, creates some restricted MCO compliance fund for penalties and fines, requires appropriation to send. So the Kentucky General Assembly would have to approve any money to spend that, but that fund would go with the express intent to support future rate increases, which we also hear from Medicaid providers all the time, talking about the rates being too low. It would also, I'm going to skip forward to some of the other good parts. So for data collection, it expands ongoing eligibility related data checks and directs prompt redeterminations when data suggests a change. Sometimes there can be lags there. And it also includes some new explicit data sources with a transportation cabinet for NEMT related checks, which I'm very excited about because there can also be a disconnect between eligibility between those two systems with Medicaid and Transportation Cabinet for non-emergency medical transportation. And it also creates a dental carve-out from Medicaid that would establish a new administrative service organization that it's based, there's one in Connecticut that often promotes higher provider satisfaction and access. So those are some of the great things, some of the good things that we're watching in HB2. If you are interested in digging more into this, we will be covering it at our next Keep Kentucky Covered Coalition later this month. So be sure to join that and we'll dig a bit deeper into HB2. So with that, let's move on to the next slide. All right, child renewals. They are still happening, y'all. If you haven't known, if you didn't know, they restarted back in July 2025. We're about 7 months through now. And the first notices went out back in May. It's really, really, really important to make sure that contact information is up to date and Connect. So if you don't know how to do that, you can log into the Connect self-service portal or reach out to the Connect hotline or reach out to a connector. Folks can also ask providers at the office, at their doctor's office, to check the KY HealthNet portal that they have access to see when their renewal is scheduled. As soon as you get any mail, make sure that you review it, check it out, and respond to any notices requesting updated information. If folks do not return that information that's requested, they can lose their coverage. So reach out to a connector if you need any help with that. We have a great one-pager here in both in English and Spanish, and the Department of Medicaid Services also put together a children's renewal packet that is linked there as well. Next slide. And as a reminder, the income limits for children are much higher than for adults. We often hear from folks that parents will look at the income limit and think that, oh, we're over that income, so no one in the family is eligible for Medicaid, so I'm just not going to bother filling out any information or sending anything out. But the income limits for children are much, much higher much higher than they are for adults. So a family of four, let's say making $50,000, the limit, the 2 adults, 2 children at 50,000, the 2 adults in that family are not eligible for Medicaid, but the children are. So it's really important, if you're ever in doubt, if you receive anything, just fill out the information, send your information back, and let the state make the final determination. And kids are granted 12-month continuous eligibility. So once they're approved, they're all set for the year. So when in doubt, fill it out and make sure that you spread the word so that folks know what's going on and how to handle their renewals coming up. Next slide. So just a quick overview back to December. It's our most recent data that we have. The vast majority of folks were approved. They broke it down by age group, and looking at kid renewals specifically, around 20,000 were approved, while 2,900 were terminated. So just keeping an eye out for that. Next slide. And overall, since July, over 137,000 children have gone through the renewal, and 134,000, 82% have been approved, while around 18% have been terminated, showing that most children have been able to remain eligible for renewals as they've been successfully completed. But the number one reason that we're seeing for terminations is that folks did not return a form or the verification that was requested. So if you're hearing of any stories of people having trouble returning their form or that they did return something and were still terminated, please report those. Please reach out to myself or any other connector and report that so that we can make sure that there aren't any technical issues or barriers preventing folks from being eligible or for being determined eligible for Medicaid. So keeping an eye out for that. Next slide, please. And if you do lose coverage, make sure the first thing you do, go into Connect, update your information, reach out to a connector. They can help you update that information in the system, submit any documents that you didn't submit, and the state, you'll have 90 days from that date of the loss of coverage for them to reinstate it. So as soon as you realize you lost it, make sure to submit those documents, reach out to a connector for help. Next slide. And as a reminder, the state still, Department of Medicaid Services still does an ongoing stakeholder engagement meeting. It's every 3rd Thursday of the month at 11 a.m. It's the next one that's February 19th. You can register there. And they talk through all of the big policy updates that are happening within Medicaid. So it's a great time to ask questions directly from the state as well. Next slide. And we are still collecting stories. So if you know folks who have lost, who either are paying higher premiums or they chose not to enroll in a plan because premiums were too high, we want to hear it. It's so important that we show policymakers the real impact of rising costs. So please take 2 minutes to share your experience and just let us know what's going on. Next slide. And as I mentioned, the next Keep Kentucky Covered Coalition is the third Wednesday of each month. The next one is February 18th. So please join us. We'll talk more about HB2 there as well, and any other questions related to Medicaid. Next slide. Okay, and other resources are linked here. You can always check out KY Loop for help for all of our one-pagers. We run the gamut of all of our safety net programs, including stuff about non-emergency medical transportation, immunization timelines, SNAP work reporting requirements, full gamut. So you can check them out there, and also check out our Keep Kentucky Covered toolkit for your advocacy. That also has some specific One Big Beautiful Bill related one-pagers as well. Next slide. And with that, turning it over to Adrienne.
Thanks,
Thank you.
Priscilla. Good to be with you all this afternoon. Adrienne Bush with the Homeless and Housing Coalition of Kentucky. Next slide. Okay, so I thought we might zoom out a little bit this afternoon to get a lay of the land of what federal housing assistance what it's been through over the last year. Dustin touched on it a little bit during his section, but I wanted to remind folks that about a year ago, access for a lot of homeless service providers and housing authorities to the HUD grant portal was abruptly cut off, which provided a pretty chilling effect on service providers and folks receiving housing assistance. It was quickly reinstated, but similar to the SAMHSA debacle earlier that Dr. Schuster mentioned, it's incredibly disruptive. I know I don't have to explain that to anyone on this call. Moving ahead to May, we have the administration skinny budget release, which proposed to significantly cut homeless assistance and rental assistance. In July, we had an executive order entitled Ending Crime and Disorders on America's Streets that would direct federal agencies to address homelessness through increased forced institutionalization, data sharing with law enforcement, and implementing barriers to receiving housing assistance. From August through September, congressional appropriations work continues, but as we all remember, the government shuts down from October 1st to November 12th. Reopens on November 12th with a continuing resolution for HUD programming through January 30th, 2026. Next slide. And the day after the federal government reopens, HUD publishes an extra unnecessary fiscal year 25 continuum of care notice of funding opportunity with the due date 60 days ahead of time. And this NOFO encourages transitional housing projects at the expense of permanent housing, as well as a number of backward-looking policies that have been demonstrated to fail over the last 30 years. There were 2 lawsuits filed. Kentucky joined about 20 other states, and 2 pathways for continuum of care project renewals emerge. The litigation results in a preliminary injunction. HUD issues a NOFO to renew projects expiring in 2026. That NOFO is due in February. Unfortunately, we still have projects expiring at the end of January, beginning of February. Continuing resolution language, the budget language for the rest of the fiscal year, actually directs HUD to issue renewals every quarter until all the renewals are renewed. Next slide. So right now we're in a partial shutdown that happened effective January 31st. Continuing resolution to be voted on in the House as early as today, as Dustin mentioned, contains essentially level funding for homeless assistance and the Home Investment Partnerships Program. Home actually builds housing, homeless assistance, a lot of it pays the rent for folks who used to be homeless. There's a slight increase there. But then you can see from this chart that there are cuts to public housing. Next slide. All right, so turning to the state. From our perspective at HHCK, we feel like any good, sound housing policy will work to either increase housing supply and affordability for extremely low-income Kentuckians, improve access to housing for people who are housing insecure, or create statewide renter protections. Next slide. So a little bit about the Affordable Housing Trust Fund. It funds 3 types of projects statewide: single-family home ownership, emergency repairs to preserve existing homes, and rental development for duplexes and apartments. And it is targeted for people at or below 60% area median income, or for a family of 4 making about $52,000 a year. Right now, it's funded by a $6 deed recording fee and a $6 mortgage recording fee, and it's only generating about $3 to $4 million annually, and it's steadily declined the few bumps over the past few years. Next slide. So why is it critical? Well, because if we look at the statewide housing supply gap developed by Kentucky Housing Corporation and Bowen National Research last year, of the 200,000+ homes that are needed, 60% of the total shortage is made up by the houses needed for 0 to 60% area median income. So over half the gap is driven by housing needed for 0 to 60% AMI folks. Next slide. In the General Assembly, we have House Bill 411, filed by Representative Steve Bratcher, co-sponsored by Representative Susan Witten, who co-chaired the Housing Task Force during the interim. It would increase the fees that fund the Affordable Housing Trust Fund to a total of $36. And this will grow the fund to about $10 million a year and build an additional 600 homes. Another part of the bill indexes the fees using the CPIU measure. And overall, the increase in the indexing of the fee is estimated to result in the construction or repair of 6,000 homes over the next 10 years. Next slide. All right, so moving to the second rung, or the third rather, of creating statewide renter protections. House Bill 338 is the automatic sealing of dismissed eviction filings. Right now, about 3,000 Kentucky families are facing eviction each month. However, over half of those are actually dismissed, meaning they don't go through. The tenant pays up, corrects the lease violation, the judge dismisses the case. It still shows up on people's records, even if the case is dismissed, which blocks future housing. So this year we have House Bill 338, filed by Representative Witten, co-sponsored by Representative Dietz, with a handful of sponsors from different places across the state. Next slide. Okay. House Bill 333, it's up for hearing tomorrow in House Local Government, and it would streamline planning and zoning regulations for religious institutions working to develop affordable housing and or shelter on their property in commercial or business zones. And housing would need to be affordable for 0 to 80% of the area median income for 15 years. It only applies to cities and counties with planning and zoning regulations. And religious institutions would have to already own the property by, they would have had to have owned it as of January 1st of this year. It was filed by Representative Pollock from Campbellsville. Again, handful of co-sponsors from different places. Next slide. All right. So there are a couple of federal sign-on letters and toolkits. If you'd like to check those out on eviction reform advocacy, you're welcome to join the Welcome Home Kentucky campaign. We also have HHCK's Priority Housing Bill Tracker up with our 3 priority bills. And then lastly, the Housing Supply Accelerator. And with that, resources for advocates and consumers.
All right, well, thank you very much, Adrian, and to all of our speakers. I generally just share these resources at the end of our calls to let you all know that they're here. If you're looking for something, of course, you get lots of links and other materials in various parts of these slides. We just kind of keep this area at the end to consolidate them for everyone. And so you can take a look at those when you have a moment, whenever you get the slides in our follow-up email. Why don't we go to the next slide? I might point out just a few. Again, a reminder, this is our current schedule for Thrive webinars in 2026. This includes our forums with the Cabinet for Health and Family Services Leadership. And our next Thrive webinar, because we had to reschedule this one from last week due to Snowmageddon, we're actually going to have another webinar later this month, February 23rd, which is probably for the best because so much is happening right now, both at the federal level with this partial shutdown and other changes, and then, of course, in the legislature with our General Assembly in session. So please tune in for that and make sure all of these are on your schedule. And we go to the next slide. And then there were some questions in the chat as we were, going through these different sections about eligibility for different programs, household size, income, and just generally, how do people access the programs and services that they need? And so this is a good one-stop spot for you. We have KY Loop, which we put in the chat, a link to that includes some explainers for these different programs, along with this immunizations through the lifespan explainer that can help families, just better understand where their child is at on an immunization schedule and understand that, the different terms and make sure that they're staying up to date. So wanted to bring your attention to that. I won't go through all of the other resources that we have here, but at the end of this slide deck, you'll also find our contact information if you'd like to reach out with additional questions. Hopefully, we've been able to answer your questions in the chat as we've gone. And please join us again for the rest of our Thrive series this year, and look for our evaluation link whenever we send out our follow-up email so that we can get your feedback on what was most useful to you, what information you want more of, what you may not need as much of, and any topics that we should be covering in the future. So thank you all again. Appreciate it. Have a good afternoon, and we'll see you in just a couple of weeks. Bye.